I'm Sherine Addai, Healthy Early Years Coordinator in Hackney for Education Services for Children and Family. Today we're going to be doing a session to cover the common questions asked by parents and carers about childhood immunisation. The goal is to provide you with the knowledge to help you to make an informed decision about vaccinations. I'm joined with my guests. If you could introduce yourself, Raz.
Hi everyone, I'm Raz Chinyuku. I am a Senior Public Health Specialist for City and Hackney, and I lead in health protection, which includes vaccine preventable diseases and immunisations.
And we have Dr. Tehseen. Would you like to introduce yourself?
Hi, so my name's Dr. Tehseen Khan. I'm a GP at Spring Hill Practice in North Hackney and Clinical Director of Springfield Park Primary Care Network. I also have a NHS England role in vaccinations, so really good to be here.
Lovely. Thank you so much for you both being here for this important work around vaccinations. I'm going to start with the first question, and this is going to be aimed at public health, so you, Raz. What are vaccinations and why are they important?
So vaccines are important medicines that protect your children and yourself from serious diseases. They have saved countless of lives around the world. Most vaccines use a harmless version of a virus or bacteria to safely teach the immune system how to fight it. Once vaccinated, the body creates antibodies, and these are tiny defenders that recognize and destroy the real germ if it ever shows up. The best part about these antibodies is that they stick around. So if your child is exposed to the real disease later on, then the body is already prepared. The immune system can then respond faster and more effectively, and it will often stop the illness before it even starts.
Is it better for my child to gain immunity through infection?
Well, yes, your child can build immunity by getting sick, but that comes with a very big risk. So some diseases like measles or polio aren't just unpleasant. They can cause serious lifelong complications. So measles, for example, can lead to hospitalizations for every 1 out of 5 unvaccinated people who catch it. Polio, on the other hand, can cause permanent paralysis. Vaccines offer a safe way of gaining immunity. They provide your child and yourself with protection without ever needing to suffer through the disease. And the other benefit is that if your child is vaccinated, then they're protecting others too, especially people who are too young or too ill to be vaccinated themselves.
If diseases are rare, why does my child need to be vaccinated?
So diseases haven't disappeared altogether. They still circulate amongst us and in other parts of the world. And with international travel, they can return very fast. All it takes is one infected person coming into the community with a low vaccination rate to spark a major outbreak. Additionally, some diseases like measles and whooping cough have made a comeback. These are diseases that never really went away. Vaccines just happen to keep them under control. So when enough people are vaccinated, it creates what we refer to as herd immunity. This is a kind of protective barrier that stops the disease from spreading. But when vaccination rates drop, that barrier weakens and diseases find a way back in. As many of you will know, the UK recently lost its measles elimination status because of a poorer uptake of the measles, mumps and rubella vaccine. And we are unfortunately now seeing rising number of cases in communities in England and locally in Hackney, where uptake has also fallen. That's why staying up to date with your child's vaccinations is so important, even for diseases you don't see every day.
I'm going to move on to Dr. Tehseen. Why is it important to vaccinate babies in line with the vaccine schedule? Is it safe at such a young age, and shouldn't I wait until my baby is a bit older?
I do get this question quite a lot from parents and carers, but just to reassure them, vaccinating babies according to the recommended schedule as per the NHS is crucial because it helps protect them at the age that they're most vulnerable to serious diseases. The timing is based on extensive research into when babies are at highest risk and when their immune system will respond best to vaccines. Some infections, such as pneumococcal disease, which can cause all sorts of infections like chest infections and can also cause infections of the brain, or whooping cough, can be much more serious in younger babies than in older adults or older children. So early protection is really important. Babies' immune systems are completely capable of handling vaccines from an early age, and the recommended schedule has been designed and has been tested by experts to ensure that it's both safe and effective. However, delaying vaccines leaves babies unprotected during a period that they're most vulnerable. So it's really important that when your baby or when your child is invited for a vaccine, you bring them in on time to get vaccinated, because that's when they'll get most benefit from the vaccines.
How effective is vaccination? Does it provide 100% protection against diseases?
So just like all medications, vaccines aren't 100% effective against disease. But they are extremely effective, and we know that after clean water and sanitation, they're the second most effective public health intervention at protecting against disease and death in human beings. So extremely effective at controlling serious vaccine-preventable diseases. We think about vaccine in terms of effectiveness. So with something like MMR that has nearly 98% effectiveness, that means that you're 98% less likely to get the disease if you get the vaccine. So if you get the MMR vaccine, then your child is 98% protected against measles, mumps and rubella, which is a really high protection rate. Even though breakthrough infections sometimes do happen, and the classic one is when people say, well, I had the COVID vaccine, but I still got COVID. Actually, if you look at that, if you've been vaccinated, you're much less likely to get serious COVID infection or serious disease that lands you in hospital or, makes you unwell for weeks on end. And it also helps protect against long-term complications of that disease. So it's really important that you do get vaccinated, and it is one of the most effective tools that we have to protect people and families against diseases.
Thank you. Really useful information there. What are the side effects of immunisations, and are there any long-term effects that we need to be more aware of?
Yeah, so the good news is that most vaccine side effects are mild and short-lived. So common side effects include soreness or redness around where the vaccine was given, on the arm, for example. Children can have a mild fever, they can be a bit tired and a bit fussy, or there may be some loss of appetite or diarrhea. These can all be managed, and they're all very short-lived, so you can give things like Calpol and that can help control the symptoms, and usually they last for a few hours or a day at most. Serious side effects are very rare, so things like anaphylaxis, which is a serious allergy to vaccines, can happen, but they're extremely uncommon, and all healthcare professionals who are delivering vaccinations are trained to deal with anaphylaxis or allergic reactions. In terms of long-term side effects, again, these are extremely rare. Ongoing monitoring and research of vaccinations have found no long-term evidence of harm from them. And remember that the risks from not getting vaccinated, such as brain damage from measles or paralysis from polio, are far greater than the risk of any side effects from the vaccine.
Can receiving multiple vaccines overload the immune system?
Again, this is a really common concern that parents have, and the short answer is no. That receiving multiple vaccines at once really doesn't overload a child's immune system. If you think about it, babies and children are exposed to millions of germs on a daily basis. They put their toys in their mouth, or they put their hands in their mouth, and that exposes them to lots of viruses, to bacteria, to fungi, and the body deals with that. The immune system recognizes it, and it produces antibodies to help protect against those germs. So scientific studies have found that the immune system easily handles the amount of antigens, or those kind of material that the body reacts to produce antibodies in vaccines. And it doesn't overload the immune system, and it can help produce that memory that Raz was talking about, that can then protect them if they then encounter that real disease in their everyday life. and they can often, manage that without even getting unwell. So it is really important to have the vaccines and help protect your children and your family.
So thinking specifically about the MMR vaccine, measles, mumps and rubella, is my child likely to develop autism as a result of taking this vaccination? And is there research evidence on this?
So there isn't any credible scientific evidence linking MMR to autism. So large, well-designed studies from across the world, including children at higher genetic risk of autism, has found that there's no link between the MMR vaccine and autism. So the claim that the MMR vaccine causes autism comes from 1998 by someone called Andrew Wakefield, who published a very unscientific study in a journal that was not conducted in the right way. There was a lot of flaws in the study. And subsequently, the journal article was retracted. And Andrew Wakefield lost his license to practice medicine because he was found to be unscientific in his methodology. Subsequently, there have been many studies that have debunked this connection between MMR and autism. For example, a Danish study that tested around 600,000 children found no increased risk of autism and MMR compared to those children who hadn't been vaccinated. So the summary of it is that MMR is not connected to autism or any other neurological or developmental condition at all.
Thank you. That's really reassuring. Are the ingredients within vaccines safe? Should I be worried about them?
So vaccine ingredients are included to ensure safety and effectiveness. So you can always read the leaflet and that will give you a breakdown of what's in a vaccine. Actually, the majority of the ingredients is water in a vaccine. But there's obviously the antigens as well, which can help the body provoke a reaction and produce antibodies. So that's the part of the vaccine that actually has the active effect. There's also what we call adjuvants, which can boost the vaccine response. And they're kind of salts that can tell the immune system that it needs to work and it needs to start producing those antibodies. And there's also stabilizers that can help with the storage of the vaccine. And that can sometimes be certain chemicals, or in some cases it can be gelatin. But just to reassure parents and carers, there are vaccines available, such as the MMR, that are vegan friendly, that have not been developed with gelatin. I know this is also a concern with people from certain communities, like Muslim patients or Jewish patients. And, most vaccines do not contain any animal products. And if you do have a concern or a question, you can always ask your healthcare professional. And there is one example. So, for example, the nasal flu vaccine, we know that does have gelatin in it, but there is an alternative that you can ask for, which is the injection for your child instead of the nasal flu vaccine, and we're more than happy to accommodate that. I also, want to make the point that some Jewish patients and Muslim patients actually accept, vaccines that have got gelatin, because for them they believe that actually the benefits are greater than the risk, and because it's for a health benefit, then they may not have objections to it. So it's not universally applicable that all Jewish or Muslim patients will not accept vaccines containing pork gelatin. But this is only a minority of all the vaccines given. And like I said, if you have any questions or concerns, you can always ask your healthcare professional.
Very good. Some really useful information and very detailed answer there, especially around dietary and religious ingredients that parents may be worried about. I'm going to go to my final question for Raz. What advice would you give to early years practitioners to support the boost in immunisation efforts to keep children and the wider community safe?
So early year settings can be hotspots for the spread of vaccine preventable diseases such as measles, chickenpox, and more recently mentioned flu. As trusted professionals, early years practitioners play a vital role in helping to keep children, families, and the wider community quite safe. While some parents and carers may feel uncertain about discussing vaccinations, your role in opening these conversations gently and without judgment can make a real difference. We would encourage you to use routine moments like settling in sessions to ask about a child's immunization history with their parent or carer. You can help them check the Red Book as a helpful prompt. Please be curious but not critical. A supportive conversation can help families to feel safe to share any concerns or gaps in their knowledge. And finally, please signpost clearly. If a child's vaccinations are not up to date, please do direct the parent or carer to their GP. The GP, like Dr. Tehseen, can offer tailored advice and help them to catch up with their missed vaccinations. It's never too late to get up to date.
Amazing. Thank you. Thank you so much. We've come to a close of our podcast on vaccinations. I'd just like to say a special thank you to our professionals for answering the most common questions around immunisation. Thank you so much.